everyone. I'm Cheryl Casoni. Welcome to Cashin' In. Terry Keenan will be back next week. 85%. That's how many Americans have health insurance. So it's spending billions to give the other 15% coverage be worth the cost. Let's get the stock smarts. Our Cashin' In crew this week: Wayne Rogers, Jonathan Hoenig, Dagan McDowell, and Jonas Max Ferris, along with Stuart Varney and David Sirota, author of the book Hostile Takeover. Welcome, everybody. All right, Stuart, my favorite Brit. Most estimates say national health care is going to cost tens of billions of dollars.
Oh, forget tens of billions, hundreds of billions of dollars. That's one of the problems with it. I am a child of socialized medicine. I am British. I was born in the first week of socialized medicine in Britain. Believe me, it is wildly expensive. And in the American context, you're talking hundreds of billions of dollars a year coming out of the taxpayer's pocket. Furthermore, you do this and you put healthcare at the whim of politicians. What a disaster that is.
And they're doing so much right now. All right, Dave, let's go to you. I don't know, maybe the government can do it better. What do you think?
Well, I absolutely think the government can do it at least as well as the system that we have now. The idea that this is going to cost hugely more money than we spend is really a misnomer. The fact is, the studies have shown that if we actually have a national healthcare system like every other industrialized country in the world, we will save hundreds of billions of dollars, because right now our current system wastes about 18 cents for every healthcare dollar spent. In the rest of the industrialized world, they spend about 3 cents per dollar on administrative costs. So we can bring down our administrative costs.
Right.
One study showed that we would save $400 billion.
Let's bring in Jonathan here. Let's go to our multimillionaire friend over there in Chicago. Jonathan, you got an extra million for everybody to get some extra health care?
I think I'm paying quite a bit as it is, Cheryl. I really don't. And that's just the point, is that I'm sure you could show me a spreadsheet that says socialized health care works. I happen to think it doesn't. But it's immoral. I don't have a responsibility, I'm sorry, to pay for everyone's AZT and the respirators and their insulin. Okay, I just don't have a responsibility to do that. I mean, socialized health care, guys, it's not some benevolent charity, oh, let's help everybody out. I mean, Dave, they come to your house with a gun and they say, pay or we'll put you in jail. I'm sorry, but there is no such thing as a right to health care.
All right, Wayne, let's bring Wayne into this. Wayne, look, Massachusetts, they've got a plan. California might follow. Maybe they're the way to go. What do you think?
Well, Cheryl, I don't know whether that's the way to go or not, but what Stuart and what Jonathan are saying ideologically, that's an ideological argument. Now, I'm not going to argue that, because sooner or later it's going to come, whether we like it or not, or whether they like it or not. And it's going to come in some form, and it's going to be expensive. Our job is to try to figure out what is the least expensive way to make this work. In Britain, they have a 27% tax thing. In our country, it's 12% right now that it costs us. In Canada, it's much even higher, and you have long lines, you have all of these things. But sooner or later, we're going to have to face it, and we're going to have to do something about it, and we might as well do it now.
Wayne, my concern is that, say, one of the proposals is to make sure that every American has insurance, but you insure every American, and it sounds great, but that will only drive up the cost of health care even more, and any plan by the government will wind up costing billions more than estimates. Right now, we've got to figure out a way to get Americans to consume less health care, bring down costs, because the average cost per capita in the last, say, 15 years is already doubled.
Dagan, you've got a point about we don't know what things cost, and we talked about that before. But Jonas, I mean, I think you would agree we've got to do something. People are pretty ticked off about this issue.
Wayne's exactly right. We're going to be doing something. The question is what. So it's important to figure out what is the best thing. And what you said before is I endorse the national health care plan of the Republicans, which is, in my opinion, Mitt Romney and Arnold Schwarzenegger, which is basically mandating health insurance for the uninsured. I'll tell you what's immoral, getting to Jonathan's point, is that I have to pay the health care costs of the uninsured indirectly right now. That's how it works. So if we forced those people to get insurance, that would be fairer in a free market way for people like us. Now, sure, the government might have to pick up some of the premiums, but that is still a private market thing. That is not governments owning hospitals.
I don't see what's fair in a free country about forcing anybody to do anything.
Well, Jonathan, wait. Have you ever gotten a driver's license and registered a car? You had to have insurance. That is the law to drive, because if you didn't and you hit somebody, you're going to burden them with your costs. It can be the same way with health care.
But you know what's a burden is tracking everybody in this country if you mandate health
The
insurance. How
IRS
are they
does
going to? Not very well.
Look, we are talking here about the cost of the government providing health care for vast numbers of people. It is breaking down in Britain because of cost. People in retirement are not paying taxes, and they're living a lot longer, and they're making huge
You're right,
demands
but that's
on
the
National
government
Health
operating
Service. We're
the
talking
hospitals, paying for everything. But people like Barack Obama
are you
suggesting
prepared to take hundreds of billions of dollars off the American taxpayer to pay for other people's medical services?
But Stuart, Wayne brought up the idea of the states doing it. So Wayne, maybe it is a states issue. Maybe it's not a federal issue. It's a states issue.
Well, that would be one great solution. The question is not whether or not it's fair. Fairness has nothing to do with this. I mean, Jonathan, you can argue, oh, it's unfair, it's unfair. Of course it's unfair. Everything is unfair. We're going to have it. It's going to come. And you're right. The states is a better way to do it. It's better to even do it locally. That would even be a better way. It's going to get imposed on you, so you better get used to it, and we got to find a way to deal with it.
But why not a national housing program, though, okay? I mean, why not a national food program? I mean, I don't know. To Dave, I mean, don't you think that if we're so concerned about people...
We have those things
You
already.
have all of that already, Jonathan. You have that. You have a national... I mean, Fannie Mae, Freddie Mac, all of those are national programs. You've got this already.
Right.
You're trying to do it in the best possible way. That's what you want to do.
Exactly, and we have all those things, and there hasn't been this havoc that you say is going to happen. Look, the issue is this. The issue is if we're talking about cost, there are studies that show if we had the same administrative costs in our healthcare system as other industrialized countries, we would save
they said it about
$200
Amtrak,
billion a year.
they said it about the IRS, they said it about the post office, and they said it about every
Medicare
right now.
Medicare right now spends 3 cents for every healthcare dollar on administrative and paperwork. Our private insurance system spends 18 cents of every dollar on paperwork and administrative costs.
Dave, I think that Stuart's point, though, Dave, I think Stuart's point, though, is that actually the quality of care will go down. Do you agree with that?
I don't agree with that at all, because as we've seen, again, if we have to compare other nations,
there are planes,
other countries, they have longer lifespans.
There are planes leaving for London every single day. Go take one and go sample their medical care.
Listen, you should not have to read back right-wing politics.
The dirty little secret that no politician will ever talk about, if you want to get health care costs down, you get the government in and say, here are all the drugs you won't be able to take. Here are all the procedures you won't be able to have.
The opposite of it is that the government can negotiate lower prices.
No, they cannot.
No, they can't. Don't believe that.
No. All right, we got to leave it there, guys. All right, we got to leave it. Thanks, everybody. Great little debate there. Gas prices going up. People freak out about it. Gas prices go down. People say, hey, it's about time. Why does America feel they have a right to cheap gas? We're going to have the answers next.